Dell Medical School and the University of Texas at Austin Steve Hicks School of Social Work is now working on a digital platform that tracks opioid and other drug overdoses here in Texas.
And it's called Project Connect. Joining us this afternoon is the lead researcher on the project, Casey Claiborne, who is a clinical psychologist at Dell Medical School at UT Austin. Casey, okay, this could be a dumb question, but how is this data gathered?
Yeah, so we're actually partnering with the community to gather data from the community. So historically, we primarily gather data from electronic medical record systems and from medical examiner offices. And we really have a huge gap in the amount of data, particularly related to non-fatal overdoses. And also, you know, if Narcan is being administered and some of these details that would really help to inform prevention efforts moving forward. So we're asking the community to help report overdoses for us when they occur. We're primarily working with harm reduction organizations right now. And those are our organizations who are boots on the ground doing the really hard work with overdose prevention efforts. And they're reporting into the system. They have been for the last 4 months. And we're now launching and expanding statewide to where we're allowing community members, whenever you hear about an overdose, or have a family member who overdoses, or if you yourself experience an overdose, you can go into this secure system and report anonymously about the overdose that's occurring.
And Casey, you did mention those prevention measures. Just talk about how important those are, and are there any additional measures that you all are taking to really prevent what's a crisis here in the state?
Absolutely. So one thing that's really exciting about this project, you know, we've been partnering with the community, and the community has really driven what we've built. And what that means is our harm reduction organization partners who do the prevention work, and our community health paramedic programs who are also on the ground doing the prevention work. They have told us what to build, how to build it, and then how to deploy it. And so that's really what we've done at this point. As far as prevention efforts, we historically have done a really poor job of harnessing technology to have data-driven prevention efforts. And this tool will allow us to actually know how to allocate resources better. We'll be able to identify hotspots in almost real time to where we can better inform our community health paramedic programs, better inform our harm reduction and community outreach programs, so that their work is more targeted and driven by data.
It really sounds like what you're doing could save lives. So Casey, thank you so much for the hard work, and thank you for joining us this afternoon. We appreciate your time.